Hello and welcome to It's All About Your Health. Today we're at Memorial Hospital West at the Image Recovery Center, which is what a fabulous, fabulous place this is. And with me is Teddy Spiropoulos, who directs the activities. Tell me what you do at Image Recovery.
Okay. I'm really the director of the Oncology Support Services, and the Image Recovery Center is just one portion of my job, but I will tell you it's probably one of my favorite portions of the job because you see change every single day right in front of your eyes. And so here at the Image Recovery Center, we provide for a breast cancer patient, we provide mastectomy products, bras, bathing suits, lingerie, all kinds of products that make a woman feel like a woman again. We also have a full service salon. So we do hair, we do nails, massages, acupuncture, everything that you would get in a spa, but in a very sterile and clean environment
And private.
and private.
How many hairstylists do you have?
Right now, I have four hairstylists, and they're all very experienced
That's
in,
a lot.
in wig care. I have people that are specialized in prosthetics, which is, your mastectomy bras. Lymphedema sleeves. Lymphedema is a huge problem when we sell those as well. And the thing that I think is important is this environment doesn't feel like a hospital.
No, it doesn't.
It feels like you're in a salon.
Or a spa.
Or a spa. It's very comfortable. It smells nice. And all the services that we do are, the massages are oncology massages. The hair and nail products that we use are all organic. If you have a pedicure here, you know that all the equipment is completely sterilized and everything is changed. So everything is very individualized for the patient. We throw out the pedicure bowl. We don't.
It's disposable.
They are disposable, so we don't reutilize anything to make sure that we're very, very clean and very sterile here because people are compromised in their health once they're undergoing treatment. The other thing is,
And it's all affordably priced.
it's very affordably priced. Insurance does cover some of your prosthetics. It covers wigs, and we try not to turn anyone away based on their money. This is, after all, the Memorial Healthcare System. We're your community hospital. The other piece of it is once someone has completed treatment, we hold a whole survivorship clinic here twice a month. And that clinic is, how do we bring people back? We've taken them out of their lives to treat them. Now, how do we, get them back into society again? We talk about career changes. We talk about sexuality. We talk about infertility issues. We talk about, body image.
Things you don't talk about with
Exactly.
your doctor because you don't
Exactly.
even think about it.
Exactly. So, it is a very open, educational, and frank discussion. It's run by our social workers, our dietitians, our psychologists. It's all run by the team that really understands what these patients have gone through.
And everybody who works here totally understands what the patients are going through.
Correct.
Because so many of them are
Correct.
survivors themselves.
Correct. One of my hairdressers is a breast cancer survivor. Everyone here has had someone, including myself, that have been touched with cancer. Most of my employees are survivors. And sometimes you just have to be able to connect with a patient on that level because it's a very, very difficult time in someone's life.
And very personal.
Absolutely. And it's a family affair. Many times people come here with their children and their husbands and their, mothers and we're not just dealing with the patient, we're dealing with the whole family and trying to help everyone go through this.
Teddy, you're doing a fabulous
Thank
job.
you. Thank you for coming.
Everybody should really know that this place is available. And now you're even your hairdressers and your beauty salon is open to the public.
Anybody can come here. You don't have to be a cancer patient. Anyone can. I get my hair done here. I get my nails done here. Our staff all get our hair done. The nurses in the hospital come here. And I have many doctors who come on their lunch hour, hey, can you just get my hair done for me? Just give me a quick haircut. So we do that for them as well.
Super. It's a wonderful place, and I'm really happy to be able to let the Pembroke Pines public know that you're here
Thank you.
and you're available.
Absolutely. And thank you for coming today.
Thank you. We're going to talk a little bit with Allison and Donovan White. Allison is undergoing procedures now, and you look wonderful. I told you before, you're
Thank you.
a beautiful lady,
Thank you.
and you're, you know, I was just talking to somebody recently who said, I'm not dying of cancer, I'm living with cancer.
Right.
Absolutely.
And that's what we should all be doing.
Right.
So, I want to know how long you've been using this imaging facility and what you think of it.
I've been using this facility since August of 2012. When you come in here, you don't only get someone who says, oh, you came to pick up your prosthesis or you came to pick up this. They always ask how you're doing, how you're feeling, you know, what can I do for you. They're just really, really great.
It's part of a
people.
family.
Yeah, they are, very much so. Even the doctors, from the doctors to the nurses, everyone.
And you've been
like
to
that.
other places and you know the difference, right?
Well, absolutely. I have a very extensive background. I'm a retired military. The last position I had in the military, I was a first sergeant of the 42nd Medical Group. And I've been through different hospitals. My wife has been in the hospital, I want to say, a community for over 30 years. So we know what we're talking about when we say that the facility, when it's user-friendly, it's family-friendly. This place doesn't even remind you of a hospital.
No.
You know, as you walk in, you're greeted, you're made comfortable, you're made at home. They want to know what's the
Doesn't
best
smell
thing.
like a hospital.
Oh, absolutely.
No.
And that's a good thing too. It doesn't smell like a hospital. Everybody treats you as family, as you said earlier.
I'm really impressed with this whole place. It's made to look like you said, like a spa.
Yeah.
And they do such super things for people who really need super things done for them.
Right, they do.
So,
Well, the main core of anything that you do, if you don't believe in what you're doing, then you become very transparent. It's especially in the wellness business. If you don't belong there, you're exposed immediately. The manifestation of all of their deeds is pretty evident in the fact that it's rated, all the accolades that you get from the folks that use it. So,
Yep.
you know, touche for Memorial West for really seeking out the right people to
I
be
didn't even
involved
know a facility like this was available.
Yeah.
This is Lisa Eusebio, who is an oncology specialist, a nurse who's called a navigator. Now tell me what a navigator is.
Correct. So a navigator is a nurse specialist in oncology who educates the patient. We take the first call. We find out the patient's history. We collect their medical records. We review them. We have all of the pathology slides and imaging CDs and documentation ready for the initial consultation with the doctor. Once we're ready for the appointment, we send out an email to all of the staff who will be involved in this patient's care. So that includes the doctor, the nurse practitioner, research staff, all of our staff. So they're all aware of the new patient appointment and will be involved in the care. So at that point, everything is ready. All of the records are ready. The doctor has reviewed them, and we're ready for a very thorough initial consultation.
So you really are a navigator. You navigate the patient through all of the channels for their care.
Yes, initially when we receive the patient, we find out their story, we educate them, we guide them to the appropriate physician. If they've been referred to somebody and it might not be the right physician, we make sure that with the right physician, whether it be a medical oncologist or a surgical oncologist or whatever, that's where the nursing aspect comes in. We can totally appropriately guide the patient, and make sure that their first appointment is a timely one, to make sure, because sometimes the scheduling department doesn't know the urgency. So once we talk to them and review their records, we know, okay, this patient can't wait 2 weeks to be seen. We need to see them this week. And we get involved and we do that for the patient. And then from there, we navigate all over the place. We help them get around our system. Whether that be showing them where the PET imaging is, or where the chemotherapy suite is. If they have problems with insurance or payments or transportation, we refer them to the appropriate departments. So as far as my department is the supportive services department, we have social work. We have palliative care, we have psychiatry, we have the image recovery, and we have dietary services. So all of that is involved in our department, and we can help the patient with whatever they need from the beginning of diagnosis all the way on to survivorship. All of the patients have a new patient notebook when they first are seen. We visit them in their initial consultation, and it has all of our contact information on the front, and as well as a business card. When I do leave the office, my office phone is forwarded to my cell phone, and my work emails do come to my cell phone, so I can answer a patient's question at any time. They have never once abused it. I have never received yet a phone call at midnight, but I would be happy to answer it if it was an emergency. I'm sure, if they were that desperate, I could answer their call and put their mind at ease. So, yes, the point is to make the patient and the family feel comfortable, because they're so anxious at this time.
And so uncomfortable with so much happening to them.
Right, it's just the fear of the unknown.
Sure.
So, the more questions you can answer for them, the more comfortable they are.
Lisa, thank you so very much.
No problem, my pleasure.
This is Linda Chappelle, and she's, a Gal Friday. She does a little bit of everything. This is the salon part of the imaging center, and this is where wigs are fitted. You fit wigs, don't you?
Yes, I do.
So
Yes.
tell me what that's like. One person at a time comes in for a fitting.
Yes, it takes us about an hour, hour and a half, because we try to fit the patient. We look at them as a whole. We look at them as an individual to fit them for what the hairstyle they would like. Some like to go maybe a little blonder, a little more brunette, a little more red, maybe a little longer, maybe a little shorter, but we definitely custom fit the patient as to what look they're wanting to go through when they're in their journey.
What else do you do?
We also fit the patients for bras, prosthesis, and lymphedema sleeves. We also sell all generic products for their hair when their hair starts to come back. And we're just emotional support. We always ask the patients, when you're finishing your journey and your hair's coming back and you're deciding to get a new haircut with your own hair, please come back. We do have cosmetologists here every day of the week. And, or if not, just come back and visit us and keep us posted on how they're doing.
And you yourself are a cancer survivor.
Yes, I'm a breast cancer survivor, 10 years, but the facility was not here when I was diagnosed.
And I'll bet there wasn't anything like this.
Nothing close.
For you.
No. I had to sit in the mall and get fitted for a wig with no hair, and it was definitely not a pleasant experience. And that's what drew me.
Embarrassing.
It's just very, it adds to the emotions of what you're already going through with the journey, that it makes it 10 times worse to not have that privacy of us women being so vain as some of us can be or
Sure.
not be, to be able to not.
Even if you're not vain before.
That's exactly right.
You know.
Right. We have a lot of women that come in and say, I'm identified by my hair, when really we're not. It's who we are and our personality, but we tend to want to make it who we are. And we work with them through that part to say that this is just something you're going through.
Well, I must say, your hair grew back beautifully.
Thank you. I get quite a few compliments from the patients, and it's quite inspiring to them to see this is where I will be at the end. And that's why I'm here.
For OCTV, I'm Elaine Kugelman, and thank you for joining us today at the Imaging Center at Memorial Hospital West.